Hey, it's Sarah. I'm back to talk to you a little bit about when you have a client that's using nasalization when they need to produce an oral sound. So what I'm referring to is in English, there are three phonemes, meaning sounds, that we produce through our nose. Those would be M, N, and ing, ing, the ing, what we would consider ing. So for all of these sounds, what we're doing is opening the velopharyngeal port at the back of the mouth and letting the air come out there to make the sound. So here I'm gonna show you a technique for a nasal sound. I want you to say the word mom and touch the bone of your nose, not the cartilage, but the bone, and go mom. Notice how for the M in the initial position and M in the final position, that nasal bone vibrates. Mom. And that's how you know that we are allowing those sound waves coming from our voice box or our vocal folds coming up and coming out the nose. And you can try this with other sounds like with N and with ing. But sometimes for clients, for whatever reason, there might be a phoneme that they're allowing air to escape the nose. And so this can feel really challenging to correct. What I want to tell you is what I do is I tell the client, okay, we're going to talk about how, for example, I've had multiple clients that have nasalized S. And so when they do the S sound, you can hear some sound coming out their nose. And so what I do is I talk to them about how M, N, and are sounds that come out of our nose. And I do that exact same thing that I just did with you, where we did any kind of M or N sound or in words that I will ask them to then say, and we talk about the vibration of the nasal bone. And so then what we're gonna do, let's say it's a word like snake, and because there's an N right before the S, they might be nasalizing that phoneme. And so we're going to talk about how in a word like sun, we only feel that vibration with the N at the end of sun. Or maybe a better word might be sis, as in sister. So you can hear and you can feel there's no vibration in a word like sis. The nose bone is not vibrating because the velopharyngeal port is closed and not allowing any sound or air to escape when you produce a word like sis. So this is a lot of education, client education, as you are teaching them really phonetics, teaching them how to produce nasal sounds and oral sounds, and then talking about how a word like sit is going to be coming straight out of the mouth, not out of the nose. And you can even try to have them feel if air is coming out the nose with a piece of paper or a tissue. For a word like mom, it's very, very subtle. The nasal emission for some of these sounds is very subtle. So it would probably be better, especially for clients that maybe are less aware of what's going on, to feel the vibration of the nasal bone, because that is unmistakable. And so you do educate, and then you're going to play around with different sounds, and you're going to talk about what did you feel in your nasal bone when you did that? Okay, so, and then we're going to get into drill, because just like with every speech therapy session focused on articulation, it's going to end up with you working on these sounds over and over and over again with your clients, because practice is how they get better. If you have any questions about nasalization, please let me know. I will say that if you are working with a client who is deaf or hard of hearing, they can really struggle with understanding when to do this with respect to place. So M and N could get confused, and that can also be really tough to treat. So just keep that in mind. You know, it does boil down to trying to teach placement, teach all that stuff. I love working on artic. It's my favorite thing. And so I just want you to know that's my best tip for working on nasalization of phonemes when they're not supposed to be. Hope that helps. I'd love to answer questions in the comments. Let me know your thoughts. Thanks.